We don't want to see any restrictions on abortion. Schewel is the president of the Women's Medical Fund and is speaking on behalf of a big coalition called Raising Women's Voices. Is going to address that issue notice.
We are a proud member for giving me the opportunity to represent the coalition Raising Women's Voices of Southeastern Pennsylvania and speaking today. We are a coalition of 27 local organizations. We were convened by Women's Way, and our goal is to ensure that women's voices are heard in the health reform debate. I also want to thank our representative Sestak and Mr. Jones from Fatah's office to speak out with us today. I am the director of the Women's Medical Fund. We're our region's abortion access fund. We provide money to women who need abortions and cannot afford them. Every morning when I come into work, I am greeted by 30 to 40 messages on our voicemail box. These are from local women and teens who are seeking help to pay for an abortion. One call may be from a single mother or woman on Medicaid. She's working 2 jobs, and yet she lives so close to the edge that she has to choose between paying for an abortion or paying the month's rent. Another may be a worried mother, a federal employee. She's calling on behalf of her mentally retarded 20-year-old pregnant daughter. A third, a young enlisted woman about to begin active duty. She's willing to leave her child behind and risk her life for our country. Why do these women need to call the Women's Medical Fund? Because they, like millions of other women, depend on the federal government for their health coverage. So they are all subject to existing restrictions that prohibit payment for abortion. Now, we know 3 things about abortion and health. We know that throughout history, women have always done whatever it takes to terminate an unwanted pregnancy. We also know that legal abortions are safe abortions. They save women's health and they save women's lives. And the third thing we know is that legal abortion is meaningless if it is not accessible. Now we are faced with the possibility of restrictions on abortion being extended to even more Americans. We thank our area representatives Brady, Sestak, Fatah, Schwartz, and Murphy, and Senator Specter for voting against expansion of abortion restrictions. But despite these votes, the Stupak Pitts Amendment was included in the final House bill, and the Senate bill now includes another outrageous attempt to restrict comprehensive reproductive health care. If these new expanded restrictions are included in the final health reform bill, millions more women will lose access to abortion. Just last week, we spoke with the mother of a preschooler who said to us, "I'm thinking of ways I can fall or whatever I can do to end this pregnancy," because she could not afford an abortion. If the final bill passes with the current language in the Senate or the House bills, more Philadelphia women may be taking these desperate measures, and this we cannot accept. There can be no further compromise on the backs of women and girls. For the sake of women's health and women's lives, we can tolerate no further restrictions on abortion. Today, the members of Raising Women's Voices of Southeastern Pennsylvania call on all our members of Congress to remove discriminatory barriers in the final health reform bill and include comprehensive, affordable reproductive health care, including abortion, in this historic health reform bill.
Mr. Grandfather, we're focused here on the House today, but of course we want to say something about our senators who've been working so hard, Senator Casey and Senator Specter. On Thursday we we went down to Washington with Georgia and Kohler's collection of birthday holiday cards with healthcare wishes. And we spent some time in Senator Casey's office. Then we had a long meeting with Senator Specter, who was talking about how he needs support and what we were trying to do. And we sorry, we might not get a public option to send bill, but tell us what to keep fighting for. Anthony Youngblood from his office is here today, and he's going to say a couple words.